Well, hello, I'm Dr. Michael Helgeson. I'm one of the four founders of Appletree, and I'm its Chief Executive Officer. The legacy of Appletree Dental begins with the four founders of Appletree Dental, and those include Dr. Michael Gavino, Dr. George Goldhammer, and Dr. Barbara Smith, and myself. When we co-founded Appletree, our vision really was pretty limited to geriatrics and adult special needs, long-term care. The four founders were all really concerned about access to care and delivery systems and payments and things for that particular group. I think at the beginning we were hoping to influence policy, education, practice for that target of special needs older adults. But really it was as we collaborated with more partners that we started exploring serving other populations. I think some of the things that I'm most proud of are how we've learned to collaborate with different communities. This collaborative practice, community collaborative practice model, which is a way of listening to various communities and then working with them and rethinking. If there hadn't been any kind of dental delivery system, what would be a great one? How would we engineer that? Would it involve mobile services bringing care to patients? Would it be interprofessional where the medical teams, the nursing teams, the mental health teams are all helping, working with us as a team to overcome barriers? But our vision is really to foster partnerships that create healthy communities. And it's really those partnerships that are so amazing. Those partnerships to create healthy communities, that's really where the oral health, medical health, behavioral health, all those things come together, and we can work together to help each other overcome barriers and improve outcomes. I'm excited about the partnerships we currently have, but also the new partnerships that we'll be fostering in the years ahead. So as I think about my professional legacy here, as I have become literally a geriatric dentist, as well as being educated as a geriatric dentist, I really think it really is the story of all the people that I've had the good fortune to team up with. Thinking about all the hundreds and hundreds of people that have worked at Appletree, whether they volunteered and served on the board, or whether they were employees, or whether they were community partners that we worked with. Folks like the folks in other states that came to us and said, hey, we like some aspects of what you're doing. Can you help us get started? And we'll run with it once you help us get started. One story that I'd like to share about really impacting the life of a patient is one that goes back to the 1990s. I heard this lecture, and the lecturer told the story about a girl in northwestern Minnesota who had attempted suicide because she couldn't get the dental care that she needed. And gosh, after the presentation, I scooted right up to that person and I said, well, I'm in Minnesota. I don't know who that person is and I don't know what their needs are, but if they're interested in getting connected, I'll see what I can do to help them get the dental care that they need. And so I got the name of this young girl named Tiffany. And at the time, Dr. Ali Mahebi was really mastering dental implants. And dental implants are really the gold standard treatment for someone with ectodermal dysplasia, and provided a full set of dental implants and restorations for Tiffany. And it totally changed her life. After she got those implants, she went on to great success in school. She became actually a spokesperson and mentor for other people with ectodermal dysplasia, and has gone on to have a wonderful life. As I envision the future of both Appletree and dental public health more broadly, I see a couple of big trends. One is the integration between oral health, medical health, behavioral health, and really even education, starting with preschool and school, and just more broadly through education as a whole. So interprofessional teamwork really growing. I think a lot of the work we're doing in that space has been groundbreaking, and I just see that continuing. Everybody wants to see higher value healthcare that produces better outcomes for patients, but also costs less and can be done with fewer people in the workforce. We don't have enough workforce in the healthcare professions in general. So I see a focus on really working towards what's called value-based care, and that's working across all the payers, public and private payers and individual payers, and then really using research to really evaluate each and every intervention, each and everything we do, and find ways to do those things so they have greater positive impact on health and cost less, or at least cost an optimal amount. As we celebrate our 40th anniversary, I want to give a special shout out to the organizations that have sponsored this event and made it possible for all of us to get together, enjoy this time together, share memories together, and so on. Each and every one of our event sponsors are fabulous partners of AppleTree. Their sponsorship is just the tip of the iceberg of the incredible relationships that we have with each and every one of the sponsors. I hope everyone here today shares their thanks to all of the sponsors who, again, not only are making today possible, but have contributed to our entire history as well.
On behalf of Patterson Dental, congratulations to AppleTree Dental on 40 years of advancing oral health. Your mission to overcome barriers to care closely aligns with our own of strengthening the people who keep us healthy. We are proud to partner with an organization whose innovation, compassion, and impact are felt not only in Minnesota, but across the nation. Thank you.
Congratulations, AppleTree Dental, on 40 years of outstanding service and innovation. South Country is proud to have partnered with you, working together with a shared passion for serving vulnerable populations and expanding quality dental care to rural communities. Your commitment has made a real difference in people's lives and helped build stronger communities. We are truly thankful and proud to celebrate this moment with you. From all of us at South Country, thank you for your unwavering dedication and partnership. We look forward to many more years of collaboration, making a difference for the people and communities we serve.
My message to everyone that supports and has supported AppleTree Dental over all these 40 years, your support is the catalyst. It's the key missing ingredient. If we didn't have your support, what we earn from serving the underserved, publicly funded patients we have isn't enough to go beyond just the status quo and change the underlying problems that are causing the lack of access to dental care. One message that I would just love to send to everyone on AppleTree's staff, past and present and future, is you really are the family of AppleTree Dental. You are the hearts, the hands, the compassionate caregivers that really make everything at AppleTree happen. You make a difference not only in the direct patient care you give, but in the educational programs that oral health and other healthcare providers experience throughout their careers, how we work with other kinds of healthcare providers and how we teach them how to provide oral health services or identify oral health problems and work with us as a team. So I just can't thank you enough. I'm so lucky. I'm so lucky to be the CEO of AppleTree Dental, because almost every day there are little moments where I hear about something really terrific that someone on our staff has accomplished. we're making an incredible impact. And I just couldn't be more proud of each and every person on our team for their perseverance, their compassion, and their unwillingness to accept the status quo.